Our next session, engaging healthcare professionals in policy actions to protect children's health. And we're very fortunate to have my friend Katie Huffling here. Katie is a certified nurse midwife and directs the Alliance of Nurses for Healthy Environments. She works with nurses all over the country in a variety of environmental health issues, including climate change, chemicals policy, and inclusion of environmental health into nursing education and sustainable health care. And I welcome you to Alaska, and just so pleased that you're here, Katie. Thank you.
Hi, good morning. And thank you so much for sharing yourself with us, Donna. That was truly powerful, and is really one of stories like that is one of the reasons that I do what I do. And as Pam mentioned, I'm a nurse midwife, and I practiced for a number of years. And as I was seeing women and babies impacted by environmental exposures, I had such a strong calling to have to do more, not just on the individual level, but working with communities and working with nurses around the country so that we're positively impacting millions, not just the few women that I'm able to see in the office every day. So I'm here to talk about engaging healthcare providers in policy so that hopefully we don't hear as many stories like what we just heard. Hopefully we can prevent disease before it happens. And I think, when healthcare providers see a patient in the office, usually by then we've lost that chance for prevention. And so I think we have a moral and ethical calling as healthcare providers to then be engaged in policy issues so that we are able to prevent some of these very serious and potentially tragic diseases. And so I tried to craft today's talk based on some of the things that people were talking about yesterday, examples of how healthcare providers, I'm in the lower 48, so all my examples are from down there, but I'm hoping after this that I will have many Alaskan examples that I can include in future talks on how healthcare providers have been able to work with communities and other advocacy groups on creating really good policies that are health protective. So some of the things I'm going to talk about are working with our lawmakers on passing protective laws, as well as working with regulatory agencies like the EPA to make sure that they're doing the right thing. So why healthcare professionals? The Gallup poll every year does a poll of the US asking who are the most trusted health, professionals. And as you can see, nurses are number one. We're always number one because we rock. And of course, Congress, they're at like 6%. They're always way at the bottom. And I had to say, the only year the nurses were not number one was after 9/11. The firefighters took number one, which was totally appropriate, but then the next year we were right back on top. And so in the 90s, the Institute of Medicine released a report on nursing and environmental health. And so I think this started really a revolution in how nurses and other healthcare professionals recognized that in order to address environmental health issues, we needed to be engaged in policy and advocacy. And they specifically called it out that we need to be engaged both where we're practicing as well as in our communities and the state and national level, working to have protective policies enacted. And my organization, the Alliance of Nurses for Healthy Environments, worked with the American Nurses Association several years ago. They have it's called their Scope and Standards of Professional Nursing Practice, and this is supposed to be like the basic level of what all nurses should be incorporating into their practice. And we were able to pass within that environmental health is a basic level of nursing practice. And within that, we were able to get policy pieces that nurses need to be engaged in policy activities, that's a basic part of nursing practice. And then a number of nursing and medical organizations, public health organizations have all created policy statements around this as well. And so sometimes when I'm working with healthcare professionals, they're a little hesitant to get involved in some of these issues. And I'm like, well, you have policy statements in your professional organizations that say you need to be working on this. And what I love with American Public Health Association, I went to go pick out a policy statement. They had over 400 statements on different environmental health issues talking about how healthcare professionals need to be engaged in policy statements. And so I say, you've got this kind of a safety net when you're getting involved in policy activities, that your professional organization is saying, yes, this is something that's important and you need to be engaged in. So you don't need to be scared or think that, professionally there could be backlash, because your professional organization is saying, yes, this is something important that you need to be engaged in. But unfortunately, a lot of healthcare professionals aren't that engaged. Like if you went to the talk yesterday at lunchtime, she was saying, well, they only have one physician who will speak out about the poor air quality there. And we definitely need more health professionals being engaged on these issues. So why aren't more when we know that they can have such a positive impact? One of the reasons is that environmental health isn't included in their education. Physicians, nurses, they're very lagging in their education, and so we need to get them starting out educated. And then, once they've graduated and are practicing, having continuing education on environmental health is really critical. They may not feel like they know the science, that they're not like the climate change expert. And I counter with that you don't need to be an expert. Just like we've been hearing these personal stories, healthcare providers who are seeing the impacts in their patients can tell those stories without having to be know all the ins and outs of climate change science, or how certain neurological toxicants impact the growing brain. But you can say, this is what I'm seeing in my practice and in my communities, and that has a really powerful story. I put controversial in quotations there, because I feel like a lot of environmental health topics really aren't that controversial, but in some communities, the providers may feel like they are, and I'm going to be talking about some of those today. And then finally, they may not know how to be involved, how they can have their voices be heard. And so my organization and some of the other organizations here, we're trying to help connect those providers who want to be involved, and through things like this summit, on how they can engage and have a positive impact. And I think one of the most important things, and it's been talked about here throughout the last 2 days, is that we need to work together. We all have limited time and limited resources, so how can we combine forces for good, not evil, and work together, because the chemical industries and the polluting industries, they have so much money, they have all this time, so we need to work really smart and work together to protect the health of our communities. And again, this is just kind of why healthcare professionals, why our role in policy pieces. And one of the things I wanted to highlight on here is this, one of the nurses that I work with had this in a presentation, I just loved it, is we're a powerful witness to innocent suffering. And, if you're a nurse working in an ER and you're seeing all these children coming in with asthma attacks, not able to breathe, and you're able to talk to policymakers about the suffering that you're seeing, these children that are being exposed through no fault of their own, it's a really powerful message. And so relaying that to policymakers, I think, is really important. So now I have a few different examples. I tried to pick mostly positive examples of ways that healthcare professionals have been able to engage in policy activities. So yesterday we talked about the Toxic Substances Control Act, which was a pretty much useless piece of legislation that failed to protect us from toxic chemicals. And so one of the major coalitions that worked on changing that is the Safer Chemicals, Healthy Families Coalition. And they had over 400 different organizations that were working together to change that. And my organization and others like Physicians for Social Responsibility were able to work with other health organizations to have them become members of this coalition. And it's really powerful when you go in and you speak with a legislator and you're able to say, we have over 40 national health organizations that have signed on and say that this is something important that you need to be acting on for your citizens in your state. It's a really powerful message. That's Jennifer Beal. Do you remember from Flashdance? And so, and then with some of the nurses, they were like fangirling with her. They were very excited. So she was at every year they would have a stroller brigade in DC where they'd bring in moms and kids, and the nurses and physicians would come in, and we would just storm the Capitol. And coming from all these different perspectives, these congressmen didn't know whether they were coming or going. They're just getting it from all angles, which is really awesome. And I would say if you're a healthcare provider, if you're able to do any of these events, wearing a scrub or, your lab coats, it's a really great visual. So we've had a lot of fun working on that through the years. So we'd go and we'd be a part of the march, and then we'd go meet with legislators. Those are some of our nurses there. And we actually, at one of the first stroller brigades, my Senator Cardin from Maryland, he was dragging his feet, would not sign on to the bill, and we just bombarded him with healthcare providers that day. And at the end of the day, we heard from his legislative director, and he was like, fine, we're going to sign on. He was very grumpy about it. But it was totally because he kept hearing from health professionals that this is a really serious issue, and I think he didn't want to make the nurses mad. As we were waiting for TSCA reform to pass, which just passed this summer and was signed into law by President Obama, we started working on state-level actions related to different chemicals, and one of those is flame retardants, which was mentioned a few times yesterday, which can have neurological issues with kids that are exposed. They're really toxic, nasty stuff. And so we've been able to partner with firefighters throughout the country who are being exposed. They are getting health issues from being exposed to flame retardants. So it's a really powerful message when you've got firefighters and nurses and moms all coming together saying that these are toxic chemicals that don't need to be in our homes. They're not helping to prevent fires, and instead they're just exposing us to toxic chemicals. And so these are some different nurses that have been working on this. Anne is she's in Connecticut, Kathy's in New York, Hassah's in Connecticut as well, and her kids, you can't really see well, they're all holding little fireman hats. It's quite cute. And unfortunately, the bill in Connecticut didn't pass. The Albemarle, which is one of the producers of flame retardants, is in Connecticut, and the senator in that district squashed the bill at the last minute. They had enough votes for it to pass, so hopefully next year we'll be getting them out of Connecticut. One of the issues that I've been working on is related to hydraulic fracturing, which was mentioned yesterday. And I've got a couple examples in Maryland and in Pennsylvania where healthcare providers have come together to address this within their states. So Maryland right now doesn't have any hydraulic fracturing. We were able to create a coalition of healthcare providers, concerned health professionals in Maryland, where we have my organization, Physicians for Social Responsibility, Maryland Environmental Health Network. We came together and have been working on raising awareness among legislators about the health impacts related to fracking. And through our efforts, as well as a coalition of environmental advocates, we were able to get a moratorium passed in Maryland, which is awesome. Yay. However, the moratorium is coming to an end in about a year, so we're now ramping up efforts to get a ban. So, but having the health voice was really important because I think sometimes legislators and policymakers can kind of poo-poo environmentalists. They're like, oh, you're just tree-hugging hippies. But then when they keep getting healthcare professionals, we might be tree-hugging hippies too, but they look at us in a different manner. And I loved this. They went to the State House and gave it to our governor and the leadership of the House and Senate in Maryland with prescriptions for the moratorium in Maryland. And then another example, in Pennsylvania, we were able to create this really great coalition of health organizations related to fracking. So they do have fracking in Pennsylvania. They're like one of the leaders in the country as far as oil and gas development. And it came out, I guess almost 2 years ago now, that the governor at the time he was very pro-fracking. They had told all the employees at the health department, if you get a call from a concerned citizen and they use any of these buzzwords, like they actually sent emails with these buzzwords, you're not to answer their call, you're not to call them back, and you're supposed to send that information to like this black hole where nobody calls it back. And so we actually had a couple nurses that were whistleblowers who came forward that said nobody's addressing these health concerns, and they were like, as health professionals, we have a certain ethical standing, and this goes against our ethics. We can't be a part of this anymore. And so this is Ruth McDermott Levy. She's one of the nurses that we work with in Pennsylvania. We did a big press conference at the State House. It got tons of press, and because of that, the governor then had to kind of backpedal, and they totally changed their system. They're now, with the new governor, they're really addressing a lot of the health concerns. And then from that, we were able to create this Protect Pennsylvania Health Professionals for a Livable Future. I do have to say, though, in Pennsylvania, it's been a really uphill battle. The health organizations are really scared to get involved, and the oil and gas companies have been really insidious about the things that they do in some of these communities. Like they put up funding for new hospitals or new clinics, and so it creates this tension with the healthcare professionals that work there. Could they lose their jobs if they speak out? And so we've had to really be careful the type of messaging that we do around it, and just so that we're able to get kind of more of a groundswell of health professionals working on this issue. And then this is a really amazing tale of community groups and nurses getting together for positive change. And V, what you were talking about in your community, it really resonated with me. I think there's a lot of similarities with this. So Jessie Kastner is there on the left, and she's a nurse. She's a professor at University of Buffalo. And then Erin Heaney is with Clean Air Action and in Tonawanda, New York. And Tonawanda is like a working class town. It's near Buffalo. There's a very high concentration of industries in that area. The people that live there, they're really proud of the work that they've done in those industries. A lot of people, they kind of live there their whole lives. It's like a really great community. Even though there's lots of industry there, they've got, I guess you walk around, there's lots of these beautiful parks. So it's just a really great place to live and to raise your families. But unfortunately, because of those industries, they've had really significant air pollution issues, and no one was taking them seriously. Residents would complain about, blue fogs coming in and having a hard time breathing. And the Department of the Environment kind of just poo-pooed them. No, everything's fine. The releases from these industries are fine, and no one would take them seriously, unfortunately. And so Jessie had just moved to the Buffalo area, and she works in the ER as a nurse practitioner, and she was seeing all of these health issues that everyone had kind of normalized. Like, they were like, everyone has these, everyone has anemia, everyone has these thyroid issues. And she's like, well, no, really you don't. Like, this isn't something you normally see. Like, why are people having all of these issues? This really isn't normal. And so she started going to community meetings. People had started to organize around some of these health issues and the things that they're feeling in their community. And so she said the thing that actually did it for her, where it really clicked that something was seriously wrong, is they were saying that all of their pets were dying. And so, when pets start dying, because they're smaller, they might experience these issues much sooner than a full human would. And so this is her son here holding a benzene molecule. And so it actually turns out that what was happening, so benzene you normally can't see, so I like this. She's like, so here's the benzene that was being exposed, there was a industry or a company called the Tonawanda Coke Company, Coke is something that's created in steel production or used in steel production, and they had been faking their air emission reports and had been spewing huge quantities of benzene out into the community. And so they actually had nursing students that worked with Jessie go through the community. They did health assessments and community assessments throughout the community, going door to door, doing questionnaires. And then they brought the community together. They ended up doing air sampling, the community did, and found these incredibly high levels of benzene. And finally, the EPA stepped in. They're like, we need to do something about this. The New York Department of the Environment's not, so we got to address this. And then because of that, they actually got the biggest sentence of violating the Clean Air Act ever, which was so amazing. Yeah. And what's amazing too is that the money that they're a large sum of this money is actually going to the community. And the community is guiding how that money is going. So it's a real win. And I love that she was able to help the nursing students go into the community and see how they can positively impact the health of that community. I've been trying to get other nursing faculty to do that elsewhere, so we'll see. Other things that we can do are, I work with a lot of nurses where we go to EPA listening sessions. They're throughout the country on different policies that they're maybe enacting. This is Laura Anderko. She's talking about ozone when they were changing the ozone regulations. There's some nurses in this group here on the new methane regulations around oil and gas development. And it's something that's really simple if you're kind of scared of public speaking, or if you're scared to do like a press event, doing these is really great because they don't ask you any questions. So you can have your prepared thing and you just can read it if you want. You don't have to worry that someone's going to ask you some tough questions. So I think it's a really nice way to kind of ramp up your policy activities. And then this is so much fun. So this is an event in Washington, D.C., and that's in the green is Gina McCarthy, and then next to her is Janet McCabe, who's the head of the air program at EPA. And so they have this flag program where, so the air quality days, so they have different colors for how the air quality is. And if it's a poor air quality day, kids with asthma or sensitive kids, it may not be safe for them to be playing outside in the playground. And so this nurse, so she's in the striped jacket, helped to launch a flag program at this school in DC. She did outreach with the kids in the school on how it's safe to play outside on poor air quality days. And the fourth grade class, every morning, they put the flag with the right color out, and they're very proud. It was awesome. And one of the parents afterwards was telling me that she's like, every morning my son comes up, he's like, what's the color today? And we have to check. No, we can't go out until we check. And so, and what's great is then the community sees the flags, and so it helps the other people in the community know about the air quality that day. And she was a real champion. The principal at this school said if the nurse hadn't been a champion on this, that it would never have happened, because he wanted the kids to be able to play outside. Like, he really fought for having recess, but they were able to work with it where it's safe for the kids to be playing outside, so it was a real win-win. And then finally, I thought this would be appropriate. So this is, Pam and Carol that's here, we were part of a group called the Reach the Decision Makers program to work with the EPA on different policy issues related to reproductive health. And so this is Alfred May, me, Guji Cook, who is a Mohawk Indian, and she's an Aboriginal midwife, and we did our project on chlorpyrifos, which is an organophosphate pesticide, and at the time it was Occupy Wall Street was going on, so we were Occupy EPA, yeah. And chlorpyrifos is abbreviated CPF, and so what we were collaborators protecting the future. Yeah, you can tell we had fun. We were a really great group. But I just wanted to highlight some of the things that the reason we chose CPF was it was going under review at the time for the health assessment. And we were able to then pull, based on our different expertise, some perspectives that EPA may not have heard before. And so one of the things that we talked about was that tribal communities may be having higher exposures to this pesticide due to where they reside, that they may be lower income, so they may be doing more subsistence farming, they may not be trained on how to use these pesticides, that type of thing. And then also because of Pam's expertise, we talked a lot about how Arctic populations may be more heavily exposed to this as well. Because even though they're not using chlorpyrifos, it does wind its way up here. And one thing that we found was that when we met with the tribal office at EPA, they didn't know anything about chlorpyrifos, so I mean, it was a real learning experience that even within the own agency, they may not know what the other parts of the agency are doing. And because of our work, this happened. No, many people worked on this, but it's under review right now that they may be getting rid of chlorpyrifos. It's one of the most widely used pesticides, but because of the neurodevelopmental toxicity of it, that they may be taking it off the market, which would be a huge win. And I didn't know quite where to put this here. This is a great resource for those of you that are not healthcare providers that would love your healthcare providers to be more engaged on environmental health issues. And let me know if any of you would like these brochures. I've got 1,000 of them at my home. But what we created this with Moms Clean Air Force to have parents take to their pediatrician or their nurse practitioner and say, we want you to be starting to talk about climate change with your patients, and here's why. We thought, coming from patients, it can have a different ring to it than when other healthcare professionals are talking to one another. So we're hoping that it'll engage more professionals that way. I think one of the things that's really important is not being afraid to ask for help. I think sometimes, especially physicians, they feel like they should be knowing things, and so being able to ask others for guidance around these issues, I think, is really important. Just a little light way to end here. And let's see. Oh, and one last thing I just wanted to share. Again, I couldn't figure out how to quite put this in here. So next to President Obama and in between Gina McCarthy is one of the nurses that I do a lot of work with. She's a pediatric nurse. The EPA had called me and they were like, we need a nurse for a roundtable with Gina McCarthy. And I was like, I've got the nurse for you. And then 2 days later, the nurse calls me and she's like, oh my God, it's gonna be with Obama too. And totally freaking out. She's like, I haven't dyed my hair in months, and she's in graduate school, yeah. But so they had moms and physicians and the nurse there. And what I thought was really amazing is I think one of the things that's most powerful is telling our stories. And like we've heard the past few days, these stories are so powerful. And so when she had a chance to speak with the president, I was like, oh, you're so brilliant. She told a story of how, so they're talking about climate change and clean air. And she's like, well, I'm a nurse and I've been practicing in Baltimore for a number of years. And she's like, imagine that today a baby girl is being born. She's a smart baby girl because he has little girls. Baby girl is being born in Baltimore, African-American parents. And just because of where she's being born, she's gonna have a harder time, that she's gonna have more chances of having asthma, more chances of being out of school. It's going to put her behind. And she wove this like incredibly beautiful, moving story. And at the end of the meeting, President Obama, he'd be like, the physicians would be trying to kind of overtake the conversation. He's like, no, what does the nurses have to say? Because I really need to hear what she has to say. So that's it. Thank you.